Welcome to Dr. Delaney's office. Hi, I'm Sheila, and we're so glad you're here. In the next few minutes, we're going to share some really great information that I know you're going to love. But let's first meet the doctor. Dr. Delaney, I learned that you love to surf. I understand that you're an avid surfer. Is that right?
Yes, I've spent most of my life surfing. I started when I was 10 years old. I've traveled the world doing it, did some competitive surfing, and still today I take trips around the world looking for the best waves.
We sat with your doctor this week and we learned some really great topics. I can't wait to share. I learned so much, and I'm sure you will too. Let's get started. Nowadays, more and more people are getting their teeth cosmetically enhanced, like with veneers. However, many of them just want their teeth to look better and brighter, and they often ignore joint issues and they ignore their bite. So what is your take on that?
When a person comes in, a lot of times when they're seeking cosmetic dentistry, they're looking to change something in their appearance. Well, when we do that, and if it's a comprehensive approach, some of the things that they want are going to change the dynamics. That is the way their teeth function. And if that's not addressed in the beginning by making sure we have a healthy system that's operating and supporting that dentition, things can be complicated. They may get the result, but they may be unhappy with how things feel after. A lot of people may have a condition before, and if we go ahead and change the way they function because of what their desire is, we can make that system fail. And that causes them a lot of craniofacial pain, headaches, neck aches, back aches, and it can really interfere with their life.
Should we all have TMJ evaluated before we have any type of cosmetic dentistry treatment?
It does in my practice. One of the first things we do before someone wants to do a reconstruction or change their entire look is evaluate what the actual supporting systems are and what their conditions are and what they're doing and how they're functioning. We have some new technologies that allow us to actually do that and see things we couldn't see before. So by analyzing that first, we know that we have a good starting point. There are certain risks. You can't really treat or manage what you can't see. And so if there isn't a proper evaluation of that and you get extensive dentistry, there is a good chance that a problem could surface that was otherwise quiet.
Besides visual evaluation, what other equipment or tests are used in the diagnostic process?
A visual is fine, but we're not able to see a lot of these things. And in the past few years, there's been some really significant advances in how we data collect information. So we get to see more things now. One of the things we use is a CT scan, which will show us the basic hard structures. As if you go break your leg, or we are able to see where the fracture is, where the deformity is, and that gives us just the basic starting point. But more on the forefront now has come in what's a joint vibration analysis. It's a system that the patient wears. It takes about 30 to 45 minutes to do. And what we do is we're actually able to use sound waves and vibrations to analyze what is actually going on mechanically as the patient is opening and closing. It actually gives us a computer read, and we can indicate how severe, what the situation is, and therefore directing us to what kind of treatment this person needs.
That is fascinating. Now let's talk a little bit about the treatment options for individuals who suffer with TMD.
The different treatments are geared toward what we see on the joint vibration analysis, and if we have a actually remodeling or deformity in the hard structures, we use a lot of splint therapy, and it depends on how that splint is actually fabricated, which will direct us to decompress that joint and allow healing to occur. What's amazing is our body can actually heal a lot of things. As if you were to break a leg and wear a cast, you can't take that cast off in the morning, go to work, come back and put it on. You're not going to get a significant healing of that leg. Same thing with the joint. We are actually able to decompress that joint, must be worn at all times, which sometimes takes a lot of compliance with the patient, and that's a difficult barrier for them to get over. Most of the patients that I have treated have been, once they see the results, they start to comply more, the ones that are a little more resistant, and we get that healing process beginning.
Can you tell me a little bit more about the splint therapy?
What we do is we use 3 different types usually. We have a initial one which will be called a pivot, and it's where we actually have you bite the cusps of the teeth are only biting on the back. It's a lower appliance that you wear. It does impede the speech a little bit, but people get used to that. And what happens is when you bite down, it actually decompresses and pulls the mandible down and forward, therefore letting blood flow come in there and let the healing and repairing start. The other one that we have is when you wear during daytime, and that's the one you're going to function in most of the time. 24/7, you eat with it. Occasionally we'll have people sleep with it, but a lot of times we'll put people into a nighttime appliance. It's a little more comfortable and compatible with sleep.
I hope you enjoyed those discussion topics. I know I sure did. This next segment is on the doctor's weekly tips. This is where he addresses questions and concerns that you may have. What is CAD/CAM dentistry?
CAD/CAM dentistry is where we're able to fabricate a restoration, or basically a crown, do a lot of cosmetic dentistry on the computer. It allows us to manipulate things and then actually have the equipment mill out the restoration.
Okay, and the second question is, can I get veneers if I'm a grinder?
You can. It goes back to the point of having the mechanics, the dynamic function be compatible so that we have control of what's the malocclusion or the bad forces that are placed on veneers. Veneers are just a surface placed on the surface of the teeth, so technically the dentition should stay the same, but it's when we go outside those parameters of function, which is what goes back to the original question, where people want to have their teeth longer, wider. If they're ground down, they want them to have the curvature different. Some of those requests take us outside those parameters of function, and their normal daily habits will break those veneers.
And question number 3, typically, how long do veneers last?
That's a difficult question to answer because everyone's going to have different habits and use their teeth in different ways, so to speak. We like to see veneers last anywhere from 10, 15 years. A lot of times it's less than that, depending on if there is bad habits being performed on them.
Thanks again for joining us today. I hope you feel more informed and are enjoying your experience here at Dr. Delaney's office. Make sure you don't forget to ask the front desk about the weekly specials. Also, like us on Facebook. Until next time, I'm Sheila, and we hope you have a beautiful week.